Hi, welcome to Future Nurses YouTube channel. So please subscribe and support our YouTube channel. So let's start our video. So question: if a client is sitting in a chair in his room masturbating, the nurse aide should options: report the incident to the other nurse aides, tell the client to stop, laugh and tell the client to go in bathroom, leave the client alone and provide privacy. Option D is the right option. So next, to convert 4 ounces of juice to milliliters ml, the nurse aide should multiply options: 4 into 5 ml, 4 into 10, 4 into 15, 4 into 30. So the answer is 4 into 30. Next, in giving care according to the client's bill of rights, the nurse aide should options: provide privacy during the client's personal care, open the client's mail without permission, use the client's personal possessions for another client, prevent the client from complaining about care. Option A is the right answer. Next, the last sense of dying client will lose in option: smell, hearing, taste, sight. So the last sense of a dying client will be loss of hearing. Next, a client wakes up during the night and asks for something to eat. The nurse said should check client's diet before offering nourishment, tell the client nothing is available at night, explain that breakfast is coming in 3 hours, tell the client that eating is not allowed during the night. So option A, check client's diet before offering nourishment. Next, the normal aging process is best defined as time when options: people become independent and childlike, Alzheimer's disease begins, normal body functions and sense decline, people are over 65 years of age. So options, the correct option is normal body functions and senses decline. Next question: if a client is confused, the nurse aide should. So if the client is confused, so options: ignore the client until he starts to make sense, restrain the client so that he does not hurt himself, keep the client away from other clients, help the client to recognize familiar things and people. Option D is the right answer. So next, what is the process of restoring a disabled client to the highest level of functioning possible? Options: responsibility, retention, rehabilitation, reincarnation. So option C, rehabilitation. Next question: clean bed linen placed in a client's room but not used should be options: returned to the linen closet, used for a client in the next room, taken to the nurse in charge, put in the dirty linen container. So the clean bed linen placed in a client's room but not used should be put in a dirty linen container. Option D. So next, the nurse aide finds a conscious client lying on the bathroom floor. The first thing the nurse aide should do is options: help the client into a sitting position, call for assistance from the nurse in charge, offer the client a drink of water, check for signs of injury. So the nurse have to find the correct answer for this question is call for assistance from the nurse in charge. So next question: if a nurse aide finds a client who is sad and crying, the nurse aide should options: ask the client if something is wrong, tell the client to cheer up, tell the client to stop crying, call the client's family. So if a nurse finds the client who is sad and crying, The first of all, nurse aide should ask the patient if something is wrong. So next question, clients have the right to options: smoke in any area of the facility, have access to a telephone, go anywhere in the facility, see other clients' medical report. Clients have the right to have access to a telephone. Proper use of waste restraint requires that the nurse aide option release the release the restraint every 4 hours, watch for skin irritation, tie restraints to the side rail, apply the restraint tightly so the client cannot move. So correct option, watch for skin irritation, option B. To prevent the spread of infection, how should the nurse aide handle the soiled linens removed from a client's bed? Option: shake them in the air, place them in a neat pile of phone, carry them close to the nurse aide's body, put them in a dirty linen container. So option D is the correct answer. We have to segregate into the dirty linen container. So next, a client needs to be repositioned but is heavy and the nurse aide is not sure she can move the client alone. The nurse aide should options: try to move the client alone, have the family do it, ask another nurse aide to help, go on to another task. So correct option is option C, ask another nurse aide to help. So next, to prevent dehydration of the client, the nurse aide should options: offer fluids frequently while the client is awake, wake the client hourly during the night to offer fluids, give the client frequent baths, feed the client salty food to increase thirst. So correct option is offer fluids frequently while the client is awake. So next, when transferring a client, most of the client's weight should be supported by the nurse aides. Options: back, shoulders, legs, wrists. So correct option is option C, legs. So next, to be sure that the client's weight is measured accurately, the client should be weighed. Options: after a meal, by a different nurse aide, at the same time a day, after a good night's sleep. Option C, at the same time of the day. So next, how many tips does a quad cane base have? So options 1, 2, 3, 4. So the tips which is having quad cane base is option 4. So next, before taking the oral temperature of a client who has just finished a cold drink, the nurse should wait. So if the client who just had a cold drink, the nurse aide should wait up to how many minutes? So options 10 to 20, 25 to 30, 25 to 35, 45 to 55, at least 1 hour. So the time the nurse has to wait is 10 to 20 minutes after the client having just cold drinks. So next, which of the following methods is the correct way to remove the dirty isolation gown? Options: pull it over the head, let it drop to the floor and step out of it, roll it dirty side in and away from the body, pull it off by the sleeve and shake it out. So option C, roll it dirty side in and away from the body. Next, what would be the best way for the nurse aide to promote client independence in bathing a client who has had a stroke? So options: give the client a complete bath only when the client requests, Encourage the client to do as much as possible and assist as needed. Leave the client alone and assume the client will do as much as she can. Limit the client to washing her hands. Option B. Encourage the clients. So next, a safety device used to assist a dependent client from a bed to a chair is called. Option pose waist, hand roll, transfer or gate belt, footboard. So option C, transfer or gate belt is the right answer. So next and final question. If a nurse aide needs to wear a gown to care for a client in isolation, the nurse aide must options wear the same gown to care for all other assigned clients, leave the gown untied, take the gown off before leaving the client's room, take the gown off in the dirty utility room. So correct option is take the gown off before leaving the client's room. So friends, we have come to the end of the video. So please subscribe our Future Nurse YouTube channel for the upcoming AIIMS NORCET 6.0 and also other staff nurse nursing officer exams. So thank you.